So you've just had your ACL surgery. What should you expect in the days after? Today I'll be talking to a doctor and a physio to find out just that. We've gone into surgery, everything's done, it's complete. What are the initial signs that everything went well?
Hopefully you've woken up and are not in too much pain. You will be in a hospital bed and your nurse will come and check your vitals, things like blood pressure and pulse and oxygen saturations. You'll be given some food. That's one of the first markers that you're not feeling sick and you're able to have that cup of tea, especially as you've been starving for your operation. Most patients really look forward to that.
Priorities.
So then your surgeon will come around and talk to you about what's happened in the operation, what they found in the knee, and what your next steps will be. ACL surgery is a day case procedure, so you tend to go home the same day. The physiotherapist will come get you out of bed, show you how to use your crutches safely, and then show you a few exercises that you need to do in the early post-operative period after surgery.
One of the first things you mentioned was pain.
Yes.
How would you help the patient manage that? I know talking to people, it's what a lot of people are worried about.
Yeah, we do a lot of things in theatre to manage that. Depending on your team, you will get lots of local anaesthetic injected into the knee to keep you comfortable. Sometimes that local anaesthetic is injected around specific nerves, that's called the nerve block, and that's a very powerful tool of keeping patients comfortable afterwards. And your anaesthetist will have already given you some medication in the operating room to keep you as comfortable as possible. Of course, if you are still in pain, do ask your nurse and they're able to give you more medication as well.
That's really interesting. I had no idea about any of that.
Yeah, I mean, we aim to have patients pretty much pain-free when they wake up.
In terms of movement, when can someone expect to be able to start flexing their muscles, start to put weight back on that leg?
Straight away.
Oh, great.
We'll talk about sort of from a routine point of view. There's always slight differences with certain protocols, but routinely, you'll be putting weight through the leg straight away. It'll be uncomfortable, so you'll need crutches to begin with, but essentially your full weight bearing. Movement, again, routinely starts straight away. There's often a bandage on the knee, a compression bandage for 48, 72 hours post-op, which makes moving the knee tricky. It will limit movement, but you do need to get it moving straight away. We're not expecting full movement straight away, it's just to get it moving.
So basically don't let fear take over, you just need to get the ball rolling.
There's no great expectations. It's not like, right, you need full movement in 2 days.
Go for a run.
Exactly. But you need to get it moving. Not moving it is just as bad as not doing too much.
Oh, really?
Well, yeah, in some respects, if you become overprotective of it, then that's going to create a fear. You're not going to want to move the knee. It's going to slow down what is already a long recovery. Obviously, there's parameters. We don't be doing anything you shouldn't be doing or have been told not to do, but get it moving straight away.
And what about swelling as well? Yeah,
swelling's normal. It's a byproduct of the healing process. It's going to swell. The body's generally not very good at producing the right amount of swelling. It always overproduces. So elevation is good with that. Ice is more, people think ice for swelling. That's more for pain, really. The ice isn't going to do much to reduce the swelling. No, the elevation is key, and getting the right level of activity correct. Even if you're using the crutches, if you're on your feet all day in that first few weeks, swelling's going to be worse. So you need a good balance between, right, I'm up, I'm moving, I'm doing my physio, but then I'm spending a bit of time elevating the leg, trying to control and reduce that swelling.
So if I've just had my physio, I'm flexing my muscles, I'm starting to put some weight on it, straight away afterwards, always do some elevation?
It doesn't always have to be, but a good balance. If you've done your physio or you have done an activity, you then want to, as close to or immediately afterwards, elevate it, take the weight off it, let it settle down, and then go again. When we talk about elevation, it's like 15, 20 minutes. It's not hours, unfortunately.
I don't get to sit down for a couple of hours.
Those days.
Pop on the TV.
Those days are long gone. So elevate it 20 minutes and then get it moving again, because the swelling will cause it to stiffen up quickly.
And we definitely do not want that.
No, so you'll constantly be spinning plates. 1 minute you'll be moving, next minute you'll be resting, cycle goes on.
Many wonder about surgical bandaging. So when it does come off, what should they expect to see underneath?
So there's a bit of variability in practice for these bandages, but in my case, for my patients, I ask them to have the bandages removed the next day, and patients can do that themselves. They just get unwrapped or cut over the front. What you'll find underneath is some sticky dressings. They're water resistant, not waterproof, so if they get a little bit splashed, that's okay. You can't stand in a shower with them on. Sometimes there's a little bit of blood, dry blood underneath the dressings. That's nothing to worry about. But if they are completely soaked, then you should try and seek some help.
So I think you said this earlier, but you said it's the same day surgeries. I have it in the morning. Can I be home by the evening?
Yeah, that's very much within realms of possibility. If your operation is done early and you have enough time to get up and about with the physiotherapists, have your medication, don't feel sick, and have your x-ray, you're able to go home the same day. If your operation is done later on in the day, it may be a bit of a stretch to get you home that day, and you may need to spend one night in the hospital. That's quite common practice.
Thanks for watching. For more videos on the ACL, click here.